What's next? The hips?
So, yeah, so let's go to the hips. I'll have you lay on your back. So what we're gonna do is this is something simple at home, is you're just gonna grab your knee and pull it all the way towards your chest. And just sort of see what we're able to do. Can this leg stay flat on the ground? Is he able to get it really close? Now what are you feeling with that?
I get a pinch in that right
hip. A pinching in the hip, okay, so that's...
What are we testing for?
We're looking for a hip flexion, right? Being able to get, some people, right, they'll only be able to pull their leg all the way up to here, right? So they're limited, their ability to flex their hip.
Yeah.
You can't squat ass to grass if you can only get your knee to here.
Right.
Right? And especially with keeping this leg on the ground, right? Now let's say you try to pull it farther and this leg popped off the ground. That's showing me that there's probably some other restrictions in there that we need to work on, right? But first thing, right? You felt a pinch in the hip.
Yeah.
Right? Just right in the front.
Yeah.
That's usually significant of a joint restriction. Just like we did with the ankle, right? We need banded joint mobilizations in order to fix that, right? So what I would do is we'll try the banded joint mob right now,
okay,
and then we'll retest that and see if we make any change.
What do you look for in this? So like, is that good or bad? Like, how much hip flexion do you want?
Should be able to get pretty close to where your thigh is close to your chest position. Yeah. Exactly.
Without the leg coming up.
Without the leg coming up.
So I got some work to do.
Exactly. Now, if that, it's actually not too bad. But if that leg popped up, probably you've got some restrictions in that hip stiffness right there.
Yeah. Okay.
It's a modified version of something we call the Thomas test.
Yeah.
Physical therapy. I'd usually have you on a physical therapy.
Right on bench, and then if this comes up,
exactly.
Yeah, one over there.
Yep, exactly. Cool. So yeah, we can jump up there real quick.
Yeah, let's do it. Why don't you do the Thomas test on Alex?
Yeah. So I'll show you sort of what we look for as a physical therapist.
How's the light over here?
Now, for people who don't know, like, what is the Thomas test? Are we just doing the Thomas test right now?
Yes. Okay. Yeah. So what I'm gonna have you do is sit on the edge of the bed right here.
Well, I was just saying, what is the test testing for?
All right. So what you're gonna do? Get your butt even a little bit closer to the edge of the bed. Okay, and you're going to lean all the way back and grab both your legs. Okay, now from right here, I'm going to let this leg drop all the way down to the bed and just relax as much as possible. Okay, so what we're looking for is what is going on right here, okay? Now this, right here, because he's got some stiffness, his knee's unable to go all the way down like this, that's some stiffness usually in the quad, right? If he was raised up like this, which you actually see a good amount of, right? That's more hip flexor stiffness, okay, right? So not too bad. His toes are turned out slightly, so that rotation is usually more like IT band stiffness right there, right? So, and then what I'm also looking for, what's going on right here, right? You have a pinching sensation in the front. Now the Thomas test primarily is looking at hip flexors and quads. However, I think you can also look at, am I even getting a pinching sensation in that hip? You're getting a pinching sensation?
Yeah.
All right. So overall, not too bad. So I would work on, right, the soft tissue work of the quads, right? Everyone knows the couch stretch, right, that Kelly Starrett talks about. But we can also do the banded joint mobilization to fix that pinching sensation.
When you do this screen, Alex, can you lay back down?
Yeah.
When you are driving the leg up, roll the leg up to see, do you want the foot doing anything specific?
No. Yeah. On this one?
Yeah. So are you looking for like if you get to here and you notice like, oh, if I let his knee go out, he like gets way more hip flexion.
Well, so that's probably telling me a little bit more about how his body is built anatomy wise. Some people, they run into a little restriction right here, and then you bring them out and they get a lot more hip flexion. Yeah. That's maybe showing me that their body's just sort of meant for maybe a little bit wider squat stance.
Okay, so it could be something like that's how the capsule's formed. And
exactly. And then just simply we can go right here and just sort of relax. We can look at his hip rotation. Right, he should have about 45 degrees or more external rotation, which is going this way, and then internal rotation.
Bad like me.
It's not too bad. Well, what you'll see is that if someone's like there, or you go out and they can't even get to like that straightforward position, that's usually really significant of a.
Is there a way to kind of test this? And I know because we're on this table, but is there a way to do this on your own without somebody like helping you, or do you need to?
The biggest thing is, the partner aspect of this is really important, so you can relax as much as possible, because while doing the Thomas test, when you bring your knee to your chest, if you're still really tense in this leg, it's going to give us a false negative, right? You need to be able to relax as much as possible to really see what's going on.
All right, banded hip distraction.
Yes, so to do this, I'd probably have you put your shoes back on so you're not sliding around everywhere.
Reebok Nanos.
Those are the Nano 5s, right?
Yeah. I wear a pair of shoes until the wheels fall off.
Yeah. I actually just found these 4s the other day on East.
I need some shoe
gear. Oh, yeah, those are 4s.
Oh, yeah.
For real. All right, so what you're going to do, right? Right hip, right?
Yes, right
Okay,
hip.
so you're gonna get in here, and you're gonna get a lot of pressure on you, and you get down into a position like this where it's pulling sideways.
Okay.
So let's try that.
How high do you want the band?
You want the band really high up into your
Sorry,
hip.
on the
Oh,
upright.
so on this, yeah, it's not too important where it's at on the upright. You just don't want it really high.
Okay.
But yeah, so somewhere down low. Now here's the deal. A lot of people will get
Get the stuff. Get your couch out of the kitchen.
exactly. A lot of people will do an anterior pull, right? So you'll see athletes facing this way, right?
Okay.
Trying to take away that pinching sensation. It's actually not doing what we want it to do. So just like the banded joint mobilization for the ankle, we want the band pulling sideways or maybe backwards.
Okay.
Okay,
Lateral
but
or
going
posterior.
Exactly, because an anterior pull is just pulling that femur straight into the front of your capsule, and it's probably, you know, smashing together a bunch of things that's eventually going to lead to pain. You stretch out your anterior capsule, that's going to lead to a lot of bad hip problems, right? Now, the reason I don't do a ton of people with a posterior pull is a lot of athletes are already very hypermobile in their posterior capsule. So most research has shown that a lateral band pull for a self-joint mobilization is the most efficient way to mobilize for that anterior pinching sensation.
Pulling straight backwards.
Exactly.
Or
so
straight
to the side.
Straight to the side.
Exactly.
Lateral.
Now what I want you to do, bring this front hip up like this. There you go. Okay. So from right here, what we're gonna do, let's get a bunch of tension on the band. Okay. Okay. So from right here, what I want you to do is you're gonna lean into it, okay, and then you're gonna push your knee out to the side a little bit. Okay. Now, do you feel a little stretch in the side of your hip right there? There's
A little
that knee
bit.
popping again.
Yeah, I feel more groin actually.
Yeah. So what I also want you to do is you're gonna take your hand and you're gonna push your knee into some internal rotation.
Yeah.
Okay, and what I'll have an athlete do is just sort of pushing in and out about 10 times.
Ah, okay.
You feel that different now?
Yeah, I've never done it this way.
I've never seen this.
Yeah.
I've never done this way.
So
Yeah.
what we're doing, right? A lot of people, they get into that hip impingement when their
I
leg
usually
is
have
very
this knee
straight.
down.
Exactly, yeah. So what we're doing here is we're sort of stretching out the ability for that femur to rotate well in the joint capsule. So we're not teaching you to push your knee in, but we're stretching with it to be able to affect the joint.
Getting a little loose.
Exactly. So I usually do about 10, and then I'll have them push out to the side a little bit.
Freeing it up.
Yeah, exactly. Yeah, it's a good way to put it. Freeing that hip up.
Ooh.
Not bad.
It's gnarly.
Yeah.
Get
So
out.
yeah, let's get out of that, and let's actually lay on your back again. See if we made any change. Now, all right, that was only about 30 seconds to a minute of that.
Yeah.
Sometimes it takes a
It
little
was
bit
like,
longer.
like 5 minutes?
All right, on your back. So, right, every single mobility work you do, right, Kelly started always talked about it, test and retest, right?
Right.
The reason for it is we want to make sure we're efficient in what we're doing, right? So, knee all the way to chest. Any change?
It's still there, but it's way better.
Okay.
And my hip flexion feels better.
There you go. So right there, you're able to see a noticeable difference in what, 30 seconds to a minute?
Yeah.
Right, not 5 minutes. So I mean, that's the big thing is if you feel an improvement, you know you're on the right track to doing something that's going to help you move better in the end. Right?
Well, even when we loaded the band up
Yeah.
in my hip, when I had the knee down and I was kind of like in a squat,
Yeah.
the pinch was completely gone.
There you go.
Like it felt free.
Yeah, and you know the way you were doing it before, like you can also mobilize in that position. So there's
Okay.
not like one set way to do this. So
That's
all right.
that's cool to learn.
Yeah, so that's the joint restriction, right? But we also have a bunch of soft tissue issues, right, that we need to work on. So the one thing I like to do is just an easy hip flexor stretch. Now, a lot of people when they stretch their hip flexors, they do this, right? They jam their hip forward. Now what you're doing is, yes, you're gonna feel a stretch in that area, but you're just smashing your anterior hip capsule and pushing a lot of things together in the front that's eventually gonna cause some pain, right? So what we need to do is how do we stretch the hip flexors if they're tight without doing that? Get into this position, put your hands on your hips, okay? Yeah, try this too, Alex, you'll like this. Okay, and then from right here, all you're gonna do is you're gonna tilt your butt under and squeeze your butt muscles.
Ooh, yeah, I feel
You
this.
feel that?
Yeah, I feel this.
It's like the craziest,
Right there.
yeah. You feel that?
Yep.
It's
Yeah.
the smallest movement. All you're doing is regular, your pelvis is here, you're doing a posterior pelvic tilt.
And that
Just
already
taking-
Tuck that butt in.
Exactly, you tuck the butt in, yeah. It stretches right there.
Yeah.
Right, so that's just, it's called the
Without even
half kneeling
extending
hip
it off.
flexor stretch. Exactly, so that's gonna get those muscles in the front that can be excessively stiff. So if you were on
I
your
like
back,
this.
right, and you're right here and this leg sort of popped up,
Yeah.
right, that's sort of significant of that type of stretch or restriction right there.
Cool.
Yeah, well, what you said, like, if you have that knee come up or that leg come up,
Yeah.
then you have tight hip flexors. Because I hear a lot of people, they say, well, I mean, hip flexors are tight because they feel things in their hip
Exactly.
around this area, but it could be just the actual capsule.
Exactly.
Yeah.
So that's a big thing, is always making sure that you are doing the right things that's right for your body, right? I shouldn't walk into a CrossFit gym or whatever and see 15 people lined up all doing lateral banded joint mobilizations, because maybe only 3 of those people need to do it, right? If you only have 20 minutes to warm up, you need to do what's right for your body. So getting screened to know exactly what you need to work on is the best way to learn how to improve your movement quality.
Oh, this side feels so good.
Feels a little bit different?
Yeah, my right ankle's tight, and I get that right hip pinch.
Yeah.
And I usually have right knee pain.
Yeah. So, yeah. There you go. So that's sort of my quick and easy screen for the lower body.
I want to ask you a couple questions. Like, what are some, so let's talk about like things that we see that are in the world that flare people up about, like butt wink and then knees caving in. I want to hear your take on those things. And
so